So are higher healthcare premiums enough to encourage more people to get vaccinated? Joining me now is a key architect of the ACA, former Secretary of Health and Human Services, Kathleen Sebelius. It's great to have you. I wonder about this because it seems to me that the insurance companies are going to have to calculate risk for the unvaccinated one way or another and what the potential costs are, whether they're doing it to pass along those costs, right, to the person with insurance or not. Aren't they going to have to figure that out?
Well, I think they will. The good news about insurance, most insurance now, is it doesn't take into account pre-existing conditions. And while there are a lot of encouragements around people getting preventive services, you waive co-pays, you waive co-insurance, there aren't really a lot of sticks at the end of the day. So I think here's one of the things insurers could do pretty quickly. Most of them had in place waivers for any kind of copay or deductible if somebody was hospitalized, if somebody was treated for COVID. A lot of those policies have ceased now that we have a vaccine. You could actually put them back in place for people who have breakthrough infections, the very few people who end up in the hospital who have already been vaccinated, and make sure that people understand that you will not get any kind of break on a copay or a deductible. Even if you're insured, you're going to pay the maximum amount if you are unvaccinated and end up in the hospital. I think it's much more complicated to talk about insurers trying to change premium prices because you'd have to collect a lot of information, and in most cases, in employee plans and others, you cannot, individually medically underwrite people, which is what we'd be talking about, looking at that specific thing. So, but employers have a lot of vaccine mandates that they can put in place, which could be very effective beyond their insurance.
So bottom line, though, do you expect this pandemic to change either the questions that insurers ask and maybe even employers ask, or the incentives that they give when it comes to things like vaccines? Because it just really feels like this issue is going to extend beyond this particular pandemic, whether it ends soon, which of course we all hope, or not.
Well, as far as I know, there is no current insurance penalty for the anti-vaccine community, right? The people who just refuse to get vaccinations, refuse to vaccinate their kids, whatever. That could change with this. That could actually be something that is implemented on a go-forward basis. I think it would require congressional intervention to change the rules for Medicaid and Medicare. As I say, you don't medically underwrite people. You don't ask individual questions. It's more rating. But insurance companies definitely could make sure that if the very few people who have a breakthrough infection continue to get waivers on copays and deductibles for their hospital stay, continue to be protected from out-of-pocket costs, and again, make it very clear that if you're unvaccinated, none of that is in place for you. So it's more of an incentive that could be done very quickly, and I think that might make a difference. It's hard to know what is going to make a difference with folks. I think also the FDA moving as expeditiously as possible and getting to full approval would be very helpful.
What about this movement toward encouraging, insurance holders toward healthier living, encouraging exercise, working out, wearing technology that tracks that sort of thing? Would encouraging vaccines versus penalizing the unvaccinated work in that same frame?
Well, I think it probably could. Again, there are lots of incentives in place around what is so-called preventive health. If you, are a pre-diabetic and you enter a weight loss program and an exercise program, you often have an incentive and offered by your company or your insurer. If you, get your screenings in a timely basis, you get incentives. So this is definitely preventive healthcare, to get vaccinated, to make sure you don't have these very expensive hospital stays and potentially death, which is, the ultimate penalty. So I think incentives fit into the category that has been tried for a long time. And actually has had some real impact on people's behavior. And
Yeah.
Smoking cessation programs work. We know that. So hopefully vaccines and incentives could work.